Okay, we're ready to go. Good afternoon, everyone. Hopefully you guys had a great weekend and had a wonderful socially distanced Mother's Day celebration with your moms and or children if they don't already live with you. So just a quick update. There are now more than 4.1 million cases and 284,000 deaths worldwide. In the United States, 137 million cases and 80,000 deaths. In California, we're up to nearly 67,000 cases and 2,745 fatalities. In Imperial, we are up to 512 cases and 12 deaths. Those numbers will be updated, but those are the recent ones from the update from our dashboard. I did get some questions sent to me in advance, so what I'm going to do is go through those first, and then if there is time, I will take additional questions. So let me start with some questions from Mario Conde at the Beyond Borders Gazette. The first question that he asked was, the number of COVID cases in Calexico continues to grow every day. What do you think are the factors that are making the city the place with the most cases in the Imperial Valley? So the problem, of course, that we have is that the actual number of cases is a relatively small number compared to larger jurisdictions. And because of that, it makes any kind of calculations somewhat unstable. But if you actually look at the numbers, for example, Calexico, with a population of just over 40,000, has 149 cases, which is 371 cases per 100,000. El Centro has 128 cases and 44,000 people, so that's 290 per 100,000. But interestingly, even though Brawley only has 114 cases, they only have a population of 26,000, and therefore their rate is 435 per 100,000. So even though the raw numbers are different between the cities, the rates are different, and that just has to do basically with our small numbers. We're a small county. We have people moving around all over the place. So it's not really surprising that we would see these numbers the way they are and expect them to change as we collect more information. So I think it really just has to do with that. We have looked to see if there were any specific things such as an outbreak in a given location or whatever that we thought might be driving the numbers, and we haven't been able to find any evidence of that. So what I actually expect that as we continue to do more testing and collect more cases, that we will see some substantial changes in these numbers. So next he asked, quote, recently it was announced that ICOE is working on a plan to reopen schools in the near future. What role does the health department have in these talks, and what will be the recommendations of the Imperial County Health Department so there can be a safe environment for students, teachers, and staff once they are back to their physical school sites? So like all other businesses, the schools have to follow the state's roadmap, and the state is developing guidance for all different industries, including the schools. And so the school state hierarchy is, with their input, going to be coming out with a document, just like other documents have come out, and that's what they will follow. So when we move to the point where we can reopen the schools based on the state's movement through the stages, then that's the document that we will follow. Like other industries, the local health department will have to validate that they are meeting the guidelines laid out by the state. But really it's about what the state decides to do, because they're going to treat the schools just like other industry. And since we're not there yet, they are not yet able to open. So the next questions that I got came from, it looks like, Alexandra Rangel, and I guess this is KYMA. The first question is to explain the process of contact tracing. So essentially what contact tracing is kind of what it sounds like, is when we have a case, then we want to know what other people are in contact with that person. And so what we do is somebody who has training in this area sits down with this person, not necessarily in person, obviously could be over the phone or whatever, but has a conversation with them with regard to where they've been and whom they've been around in the period of time before they got sick. And what we normally do is we try to go back 2 days before their symptom onset if we can, because that's when we believe that they start becoming contagious. So if in the case of a death, then we try to get information from the people, say in the family or other people who know the case, who could give us that information. So then what happens is our people who are trained in contact tracing go on to contact the other people that are identified and determine what, if any, exposure they really had, how close it was, and then, of course, whether or not they've become ill. They are educated about the signs and symptoms and the means of transmission for COVID-19. And then if additional contacts are necessary, then they go on from there. So it's really about what we call sort of epidemiologic circles, where you start with the people who had the closest contact in the period of time when the person was potentially infectious, and you collect their information and look to see if anybody has become ill, if anybody needs to be quarantined, et cetera, and then you keep going from there if you identify additional cases. So as it sounds, it's very labor intensive, and it does require a lot of work, and so it does require a significant amount of staffing. So the next question is, with regard to that, is how many people do we have working? And so we actually have a normal full-time epidemiologic staff of 4 people. And so when we don't have an outbreak of this type going on, those 4 people would be focused on doing contact tracing as necessary. So for example, when we have a TB case or a measles case or something like that, then it's their job to follow up to see if anybody else might have gotten exposed. Obviously, with what's going on, 4 people can't possibly do this, and so we have trained and repurposed other people that work within our health department staff. We have very smart, highly trained nurses and other staff who, since they're not doing clinical work right now, then they are available to do this kind of work. So they can help us with contact tracing, with serving isolation orders, with data entry, those kinds of things. We've identified approximately between 20 and 30, depending on how you look at it, because some of those people are doing sort of the data entry and that kind of stuff. But with regard to contact tracing, we have probably identified around 15 people or so, and probably we'll be identifying more. But in addition to that, those are just our local within the health department assets. The state is gearing up a program. I was on the phone with the state health officer several times yesterday, and she confirmed that the plan is for this program to be up and running by the end of this week. And we are certainly on the top of the list to get additional help. So besides what we've done internally, we will have additional external help as well. And we welcome that very much. The next question: is there any preventive measures that are being taken place to test essential workers, even if they haven't been exposed to COVID, like testing random pools of people at a work site, or is it strictly people that have been exposed? So we certainly have prioritized people who are sick initially, and then people who are exposed who might be in high-risk settings. Right now, we've been dealing with a nursing home, also with our jail. With our limited testing capacity, we have focused on those, but we have expanded outside of that initial circle and are broadly testing, for example, the corrections officers who may or may not have been exposed, and additionally, other members of the sheriff's department who might be transporting people and therefore could be exposed. This is regardless of whether they have symptoms or not. The plan is to broadly expand that. In addition to that, now that we have our Optum site available, we want to make sure that we take full advantage of that. Right now, the community is using it, but we have the capacity to use it as well. And so we want to really emphasize the fact to our first responder and our medical communities and any other essential workers that they are absolutely eligible to go to the Optum site and have themselves tested for COVID. And that message has already gone out, but we're actually working on some more specific messaging that we want to aggressively send out to the community, because we want to make absolutely sure that we're taking full advantage of the 132 tests a day that they have provided to us in the community. And if we max it out and we need additional help, that gives us the ability to go back to the state and say, we need to be able to do more of this. Please give us another site. We continue to do testing through the health department in addition to the Optum site. We have actually completely maxed out our capacity and are waiting for additional supplies. We do still have our backup, which is San Diego County's public health lab, and they are still helping us, and they are able to do the tests that we need. We're very grateful to have them. The only disadvantage to that is that, of course, because we have to transport the specimens and wait for the results to come back, it does delay the time to get the results, which can sometimes affect things that we're doing, like making decisions with regard to discharging somebody from the hospital. So the next question is when a person tests positive, who ensures that they stay quarantined? And so we provide them with isolation or quarantine orders. In this case, it would be isolation, because isolation is somebody who has an illness. Quarantine is just somebody who's been exposed. But we provide that to them, and then at the end of that isolation period, we follow up with them so they can be released from it. But what happens in between is a law enforcement issue. It's up to law enforcement, if necessary, to enforce the isolation or quarantine orders. That is not under the purview of the health department staff. We, of course, communicate. We try to make sure people have what they need. If they need help with food or other things, and they don't have somebody who can help them, then we provide them with resources in the community. But enforcement is a law enforcement issue. So the next question is that for every person that tests positive, what's the probability they have passed on the virus to someone else, and how many people are they expected to expose? So that's a very difficult question to answer because it varies by the situation, but I can tell you what the general information is. If you look at large studies initially that were done in China, but then also in other places, Europe, and even some data from the United States and whatever, the average number of people that somebody who is sick and infected exposes is between about 2 and 4. The best estimate is probably about 2.5 or 3, but it's somewhere between about 2 or 4. However, you have to consider that in certain high-risk scenarios, it's higher. So Rho-naught, which is the name that we give to the statistic that describes how many people that an infected person infects. So Rho-naught is between typically about 2 and 4. However, if you look, for example, on some of the cruise ships, that number was as high as 14, meaning one sick person infected 14 other people. What you're looking for in an epidemic is for Rho-naught, or the number of people getting infected by each sick person, to decrease. And if it's greater than 1, that means that each person is infecting more than one person, and therefore the outbreak is increasing. If it's less than 1, that means that the outbreak is decreasing, because less than one person is infected for every person who is already sick. So, of course, that's the number that we're shooting for. So all of the things that we do to limit exposure, all of these what we call non-pharmacologic interventions, so the masking, the social distancing, the staying at home, the washing of hands, all of those things were done in order to decrease exposures and therefore make this Rho-naught number go down as low as possible and hopefully obviously get below 1. We don't have a calculation for our community because we don't have large enough numbers to make the calculation, but clearly because we know that our number of cases is increasing, that it is definitely greater than 1. The next question asks if we identified a peak week, and I do not think that we can say that we have yet. We are clearly still on the upslope of the epidemiologic curve, and we will continue to monitor it, and we will see where we end up. So finally, in terms of written questions, I got something from Paul Sisson at the Union Tribune. So let me just read his question. So his question is, I'm working on a quick analysis. He went ahead and noted some of the publicly available data on a spreadsheet and notes that Imperial has a significantly higher test positive rate than either San Diego County or the state as a whole. Hospitalization rates as a percentage of total positive cases are also twice what they are in San Diego and 3 times the rate for the state. I'd be interested in any comments that any Imperial County public health authorities might have about these observations. So, Paul, in answer to your question, the number that we have, of course, again, is small. San Diego has nearly 5,000. We have just over 500, so we have roughly 10%. If you look at our death rates, which you did calculate out, they're actually quite similar to each other when you consider these small numbers. Where ours is very similar to the state rate as well. What's different really has to do with what you pointed out, which is the percentage of positives and the number of sick people and those that are hospitalized. And in large measure, the reason for that is because until very recently, we had very limited capacity to do testing in Imperial County, and we were not testing people who were asymptomatic, and we were not even testing people who had minor symptoms, We were only testing people who were really sick, in which we needed to make decisions with regard to whether or not they were going to be hospitalized or whether they might be transferred somewhere, and we needed to make decisions about whether or not they were infectious to other people. So the reason that our positivity rate is so high is because we already had selected out a population that was higher risk for having COVID in the first place, and that's what that statistic shows. The same with regard to the hospitalizations. These people were already sick. That's why we did the test, and so that skews the data. So now that we are actually more broadly testing, and we are testing people with mild symptoms, including in our clinics, and now that we're making it out available in the community where people, even if they don't have symptoms, can get tested, then the expectation is that that percent positive rate is going to markedly decrease, and that you're also going to see that as a percentage of those tested, that the people that are hospitalized is going to drop as well. It's really, in my opinion, to do with who we were testing and what you would expect were the results. Let me make sure that I got all of the questions that I got asked. Okay, so that's all of the written questions that I received. We do have some more time, so I'm happy to stop and answer additional questions.
Dr. Munday, Carol Buckley, Kxo Radio. According to the way I figure, based on Imperial County population, you're going to need 27 or 28 people contacting or doing tracing. At what point do you expect to reach that number?
Continue to internally shift could do that as of today, because we have additional people that can do this. But as I said, I was actually in contact with the state even prior to this weekend, but specifically yesterday and today, yesterday and Saturday, I spoke with the state health officer specifically with regard to this and when the state program was going to be revved up. And she told me that it would be up by the end of this week. And again, we're at the top of that really throughout the week with the expectation that we will have even more help at week's end.
Following that up, again, taking the numbers that we've been given, you're going to be in the situation where you're going to have to be doing nearly 300 tests per day. When do you expect to be at that level?
So that's an impossible question to answer because I don't have a crystal ball. What I can tell you is that we continue to request resources. We're trying to maximize the Optum site and make sure we get to our 132 so that if we need it, we can request a second site. We're encouraging all of the providers, both the hospitals but also the outpatient providers, to do additional testing. As I said, we have the capacity to get some help from San Diego's lab. We're expanding the populations that we're testing. We're now strongly encouraging essential workers, so healthcare workers, first responders, other essential workers to get tested. We're expanding our epidemiologic tracing. So we're expanding that, and the state is aware of the facts because I made it clear again yesterday, and I communicated again with them as recently as this morning, that we need additional test capacity, and they are working on helping us with that. Other questions?
This is Tom from the IV Press. Can you clarify what you meant by that the lab had maximized its capacity? Is that daily, or are you just completely out of stuff?
Yeah, so, well, completely out of stuff would not be the way to put it. But yes, we have used up some of, there's different things that you need to do the testing. And so the actual test kits that we need, we have used all of the ones that we have. We have additional ones on order. So we're hoping that hopefully today, but later this week, that we will get additional kits where we can run these in our own lab, which is what we've been doing for about the last week and a half or 2 weeks. But again, even if that's not the case, it doesn't shut us down because we have the ability to send specimens to San Diego County's lab, and they have graciously offered to help us.
The other question I had, do you foresee a time as you expand testing of asymptomatic persons that it will become mandatory to get tested?
I'm not going to speak to that because I have no way of knowing that. That isn't my decision. I don't know if at some point in time the governor or someone might make such a decision. I can tell you there's not any specific discussion of that as a population now. Obviously, at some point, there may be the need to do it in certain groups. For example, maybe if you're a healthcare worker in a high-risk situation, such as a nursing home, they may not allow you to work there if you've not been tested. I mean, those things are possible, but there's no move that I am aware of right now that mandates that people would have to get tested. Any other questions?
Yeah, this is Jason Bernstein from the Hopeville Chronicle, or from the Kxo Chronicle. Public Health Department Director Angulo said at the county press release on Friday that we're under 200 tests a day in the county, and with OptumServe and the testing site at the fairground, we should have a capacity of 230 tests a day. Why are we not meeting that capacity?
Well, first of all, just that we maxed out our public health capacity already, as I just said. The OptumServe, keep in mind that this is something that's geared toward the community. And so people have to call and or go online and make an appointment, and they have to show up. If you look at the numbers, the Optum site numbers are increasing. Some of it is, I think it just takes some time for the information to get out to the community. But as I was mentioning earlier, one of the things that we're now doing, since we're really trying to get the testing up, but also to look at other populations at risk, we're encouraging our first responders, our healthcare workers, our other essential workers to get tested. And so we plan to send out additional messaging today or tomorrow saying, hey, don't forget that this OptumServe site is here and that you guys are certainly in the groups that should and can get tested, and please go take advantage of that. I mean, we can't force people to go to the site. We are using it ourselves at the health department as much as we can. If we have, for example, a setting in which we have an exposure and we needed a group of people to get tested because they might have been exposed, so during that sort of epidemiologic stuff we were talking about earlier, we have been getting some of them to go there and use up those appointment slots, especially since we had reached our capacity at the health department. So we are trying to maximize it, but it's really about getting the community to take full advantage of it, and so we just have to keep messaging it out there to them.
Do you have an idea when we might meet the state's criteria of 1.5 per 1,000 for testing?
I don't, because again, it depends on the ability to get people to go in and get tested, and then obviously the capacity. We can meet the capacity, again, because we've got help from San Diego. Even if we didn't have enough testing in our own health department lab, we can send specimens to San Diego, and we are aggressively doing that. But again, we've got to get the community involved as well and get them to go and do the testing, because remember, testing is not mandatory, as we just discussed. So some of it is about people going and getting it done. One of the reasons that we, when this OptumServe site first happened, they really were about putting a single place in whatever county or jurisdiction they were working in and making everybody go there. And myself and others really argued that that's not the best use of this in a county like ours, because the geography is difficult. And so that's why we have identified more than one site and plan to move it around to different sites, because we want to make sure that everybody does have access to it and we do take full advantage of it. And as I said, if we can get it fully used, then we have the ability to go back to the state and say, okay, we've maxed this out and we really need more capacity. Please send us another one. And so that is something that we're working on.
Awesome. Thank you.
Dr. Munday, this is Tom from the Ivy Press again. You mentioned that you had so much staff dedicated to contact tracing at the health department, and there's a couple of numbers thrown out there, so I'm not clear exactly which number is the accurate number, because you referred to them
so
as identified.
If you want the exact number of people doing what, then you'll have to ask Paula, who I believe is on the call, because she's the one who's assigned them to different things. But keep in mind that we have sort of there's a range of things that people do. So we have our 4 full-time epi staff. And then on top of that, we've repurposed some of our nurses and other administrative people. And so some of them are helping, for example, specifically with doing contact tracing. Some of them are helping with doing things like delivering isolation orders. Some of them are doing things like helping us getting the data entered because we have to get data into the state system and whatever so we can do the contact tracing and all of that kind of stuff. So it depends on what skill set you're looking at, but we have taken a lot of our staff who are not currently doing their normal job and move them to help EPI. So that's why the numbers are a little bit fuzzy because I don't know exactly how many people are doing each one of those individual things. But we're going to continue to train more people. And as I said, we've already notified the state that we want help, and they've already told us that we will be getting help. So I don't think that we're going to have a problem getting the number of people that we need to meet that state number that people are asking about because we have a pretty good, robust program internally, but we also have that state help that's going to be rolling out to us hopefully by the end of this week.
My other question was with regard to the maxing out the local testing capacity at the lab. How many tests has the lab done so far? Or
I don't know because there's no, to me, all the tests are the same. I mean, a test is a test. So we can ask the lab director. I mean, there is a number. When I look at the numbers, I'm worried more about how many total tests we can do because, as I said, if the lab, let's just say if they can do 100 tests and we send them 150, then the other 50 then get forwarded on to San Diego County's public health lab to make sure that they get done. So the real thing that it does is it affects just the fact that we have to have then a transport person. We have to get the specimens over there. They run the test for us, and we get the results back. So it just slows down the time. But as we've discussed previously, they could run 24 specimens at a time, and they could run multiple batches per day. And so they were doing, close to 75 or more per day as long as they had the materials, and we were absolutely taking advantage of that. But now because we have an allocation from our vendor, and they only send us so much, since we've used all of that up in our lab, we have to wait until additional materials are sent to us before we at the lab can then do additional testing. But it's not preventing us from testing people. It's just meaning that we have to send those tests to a different place to get the results.
Dr. Munday, the Optum-Serve is supposed to be at the fairgrounds for at least 2 weeks, is my understanding. Is it going to be extended, or have you guys identified where it will be moving to? So
the decisions with regard to exactly when and where will be determined once we decide. When we get to the point where we feel like where it is now, we've completely taken the maximum advantage of that, then we will move it. You're right, we have to limit it. We have to move it in a limited fashion. In other words, they don't let us move it day to day or even week to week. So it'll be where it is for a few weeks at a minimum. If at some point it looks like we're not maxing it out, and it seems like that the people in that geographic area have taken full advantage of it, then we'll move it to the next location. And so our environmental health staff and our contacts with OptumServe will be the ones who help me to make that decision. And we are getting reports from them about how everything is going. They are pretty responsive to things, so I feel good that they're updating us with how it's going.
This is Paul Sisson. Can you hear me?
I can hear you just fine.
Doctor, I wondered if you could talk a little bit about kind of the border dynamic that's going on throughout Southern California right now. In San Diego County, southern hospitals closest to the border are seeing significantly higher admit rates than the rest of the region. I see that there are about 50 or so folks with COVID infections in El Centro General Hospital. I know that the epidemiology departments tend to keep track of recent travel and where people have recently traveled from. Can you tell us anything about what percentage of your positive cases or your hospital admits or your deaths or any kind of metric, what percentage of those folks have recent travel to Mexico?
So the answer is no, I can't tell you that. We certainly do know that that is an issue. We have a very busy border crossing here, and we have a very large population of people who live on one side of the border and work on the other. these are essential workers, whether they're health care workers or other essential workers, and they go back and forth. And as I'm sure you're well aware, there's something in the neighborhood of 250,000 Americans and or citizens and or legal residents who live in northern Baja and are able to cross. And we absolutely do have groups that go back and forth because they live on one side of the border and travel to the other. So we do know that there is definitely a relationship between what's going on in Baja and how it is affecting our community. And so we, because of that, have pushed up the chain of command, so to speak, to the state and then on to the federal government to make sure that they are aware of what's going on in northern Baja and how that impacts our community. And we have let them know that we would appreciate if they would provide us with assistance. So we certainly see there's an impact in our community from the border. And that's probably one of the main reasons that Imperial has been a little bit delayed in terms of seeing the curve going on, because a lot of the places in the state of California are on the backside of the epi curve. They've seen some improvements, and we have not. And some of that is in parallel with the fact that there's a very significant outbreak that's going on in northern Baja right now.
I understand there was Dr. Eastman in town over the weekend from Department of Health Services. I'm sorry, not the Department of Health Services, Homeland Security. I wonder, if they offered you anything. I mean, could they set up a field hospital? What could they do to help you guys out? And I wonder if you could also characterize kind of the overall impact on your local hospitals. Are they becoming inundated? Do you have enough resources? Or are you having to transfer people out?
Yeah, so we're following the stuff that you do whenever you have some kind of a disaster, and that is you go through your planning, and so there's kind of a hierarchy of things. And as you mentioned, one of the things that we have done is try to offload the hospitals a bit, and so they've transferred some patients either to San Diego or to Riverside. And that didn't just happen. We've already had somebody got transferred earlier. Sometimes that was because they needed a level of care that was higher than what could be provided here. But we've also looked at ways to try to move patients to, as I said, either typically it could be other places, but Riverside and San Diego are obviously the ones that are closest to us. But in answer to your question is yes, in part. We have pushed up through the state and then on to the federal government some requests to provide additional assistance, such as a federal medical station, and those requests have been submitted and are in the works. And when we get some confirmation, then we will be sharing that with the community.
Thank you.
You're welcome. All right, any other questions for me? All right, I'm going to stop there and let Chief Rohodas see if he wants to say a few words.
Doctor, you said enough for all of us right there. I think you covered all the bases unless there's any direct questions for me.
All right, then. Thanks very much, everyone. Have a wonderful Monday and the rest of your week. And I am sure that I will be talking to many of you again next week. Please stay safe and continue to socially distance yourself. So have a wonderful day. Thank you.